Hi, again. Okay, I told myself I would stop talking about this virus because you guys are getting annoyed and think I'm really paranoid. But I just can't help it. I have to ramble about it. I'm sorry. I just need to spread awareness because I don't feel like people are getting it. And thanks to those of you who have PM'd me and have told me that you found these posts helpful, I'm really glad. So I just wanted to share something that came out 2 hours ago from New York City. So they're testing 2 people over there, and one of them is not this guy who came out to the news media. He basically was on a business trip in Japan for 5 days, came back with a hacking cough and a fever, goes to the hospital, asks them to test him for the virus, and the CDC said, no, you didn't come from China. That was a few days. Okay, and that happened before the CDC made their changes on their criteria for testing people. So he gets better, goes home, calls to get tested again. He's like asking to be tested, and the CDC said, no, because you're not sick enough. He's not in the hospital anymore, he's at home. Okay, so he's quarantining himself for 2 weeks. Kudos to him for being responsible and logical, unlike some people, yeah. And I've been chatting with my nurse friends from Europe, and they're shocked at how little testing we are doing here in America. Trump, you said we were prepared. All right. And that is going on while we have that 1 new confirmed case in Rhode Island and in Chicago, Oregon, and then the 3 in Washington State with the outbreak. So, yeah. If people want to be tested, can we please be tested? Like, I want to be tested because I've been asking about certain patients who've come through our hospital doors, and I'm suspicious. But, you know, whatever. Too late. Okay, that's all for now. Educate yourself. Prepare. Bye.
Almost. We can do it in an automated way. Why shouldn't we be hopeful that we can come up with a therapeutic quickly?
Let me tell you the problem right now. Before I came here this morning, I was in the emergency room seeing patients. I still do not have a rapid diagnostic test available to me.
Well, that's easy to do, is it not? Is it hard to manufacture?
It is easy to do for some countries. What happened in the United States is that the CDC created a test,
up a reagent,
sent a test out to 50 states, and then said, oh, hold up, don't use it, let us fix it.
How quickly
it's
can
now
we get
March.
on track now, Matt?
We hear that it's coming very soon, but I'm here to tell you right now, at one of the busiest hospitals in the country, I don't have it at my fingertips. I still have to call the Department of Health. I still have to make my case plead to test people. This is not good. We know that there are 88 cases in the United States. There are going to be hundreds by middle of the week. There's going to be thousands by next week.
So
and this is a testing issue.
What do you do with people in the emergency room if you can't test them?
Well, we call and we try to test. We isolate them. We have an outstanding team